So we need safety blueprint that can help us to perform risk manager and risk control. No one wants to be a Dr. Dun. Under the circumstances of filler injection, there is an important trinity. We should have good communication with our patients, and we should know much about the facial anatomy and the filler injection principles, and we should adopt and having the good product with antidote. What's the worst case scenario in filler injection? I think they are the 4 horsemen of the apocalypse. The first one, pestilence. It stands for infection, war for blindness, famine for stroke, and death for skin necrosis. As you can see, that's a referred case.
Vascular complications. And the last thing is Dr. Henry already mentions the history of prior operation or injection, that is H. Well, past history, right? So if you if the patient has been done the open rhinoplasty or that she has performed filler injection before, the vasculature has been changed. So it is more chance to make a vascular complication. So you always have to ask to the patients about past history. And then you have to prepare, or you can get the more money from the patients because it's more danger, right? So that you have to always have to think about the past history. So this is I think it's the last paper of my presentation, and right now I'm doing experiments to the rabbit eye again.
Maybe some of you already heard about the math gun and technical map. And 130 years ago, Newberg in this world has reported the first auto fat grafting in humans. And since then, many strategy and the concept have been proposed. That the previous Henry and the Wang say a tsunami is extremely large wave caused by a violent movement of the earth under the sea. So whenever you do a soft tissue filler, including fat grafting or numerous fillers such as HA and collagen, the tsunami of the treatment is vanished or even dead.
Some improvement of the aging process, but if sagging is too much, then you of course you have to do the thread lifting or the facial operation liftings. Oh, that's it is quite very difficult to tell to the patients the exact point, but you always have to think about that, the limitation of the operations.
Okay, Henry, what's your opinion about this question?
If the patient don't want to perform surgery for the mini invasive procedure, I will give a straight lift for the lateral face, and then for filler injection for the anterior face, mobile face, and maybe combine with the Botox or something else, and or energy-based devices. If patient accept the surgery, I think just like Dr. Wang mentioned concepts, I will tell her, you have sagging face. I think the surgical procedure is good for you. So maybe I will ask her to looking for a plastic surgeon for the fast lift, and then consider about the